Hello everyone, thank you for joining today's session. Yeah, we will wait for 1 or 2 minutes. Then we can get started with our session. Yeah, I guess a couple of members are here. Now, as per our timing, we will get started with our session. So, yeah, sharing my screen to get started with. I hope my screen is visible to everyone. So, yeah, today we will be discussing about the medical imaging and segmentation. So first of all, I would like to give the introduction about myself. So I'm Kiran Jadhav, currently working as a product manager, product owner and manager in the image technology department at 3D Surgical, and having 8 years of experience in the medical domain. So, and I have segmented more than 4,000 segmentation from head to toe. So, if I give you my background, so I started my journey in the medical domain from Amplitude also, where I was working as a biomedical engineer, where I learned about the medical segmentation and the design. Then I moved to the organization to 3D Surgical, where I got a chance to work on the neurovascular project, also SOMA project, and the couple of AI initiatives that I was working on. Currently, as I said, I'm working as a product owner. I'm also working with my software team and also working closely with the regulatory team as well. So, yeah, this is about me. So, moving ahead with our topic about medical imaging. So, first of all, in this particular session, what we will be going to cover in this particular session. First part is why medical images are critical in modern healthcare. Second is how medical images are created and stored. Third is the role of DICOM in the medical imaging workflows. And fourth is what determines the medical image quality. What are the factors that affect the scan quality? And fifth is how medical images are used clinically. So these all points we will be going to cover in this session. So first of all, when it comes to the imaging part, like if I talk about one particular scenario, if a particular patient had an accident and he's in the emergency room and surgeon is looking at him, but he's not aware about his patient condition, like how much injury is happened to the patient. By looking at the patient physical appearance, he will not get the complete idea about how much the deformity is the patient is having. So what will be the solution, like how he can get the insight about the patient condition? Definitely by means of the medical images, like the surgeon can diagnose by looking at the images itself, and he can have the accurate diagnostic and pathology detection. And also for the preoperative planning also, these medical images are referred to before going ahead with the surgery. If he better plan to the surgery, then the final outcome will be much more better than the surprises. And also after the surgery, also if the surgeon wanted to see the condition of the patient, then they always refer to the medical images as well. So if we move ahead, we talked about why medical images are important. Now moving ahead, what is the medical image means? So as you can see the definition, medical image is a digital representation of the internal anatomy or the function of human body. Like you can see on the screen here, there is an image of the brain, which is having the 2D image, and it is having the couple of bright pixels and couple of the dark pixels, which is having the variation in the intensity. Here in this image, you can see these are the darker pixel, these are the couple of slight dark, these are the bright pixels. So each and every pixels is having intensity. So we will be going to talk about these pixels value deeper in the upcoming slides. So this is the 2D representation. But if you talk about the voxel, then we can consider this third image as a voxel, which is the what we can say, which is the outcome of these particular 2D image itself. So we have talked about the medical image. What is medical image? But how these medical images are captured. So there are a couple of modalities that we are able to see it here. You guys may be familiar with all these imaging modalities. First is the X-ray, CT, MRI, ultrasound, and PET. So if we talk about any fracture, like what picture comes in our mind, like the surgeon refers to the X-ray itself to get the idea about the fracture, how much it is, how much the severity is. Second is the chest pathology. If you talk about my own example, I was suffering from the pneumonia. Like surgeon suggested, the doctor suggested me to uh, get X-ray done. So where that X-ray was talking about my condition itself, like if you have the normal condition, then your lungs will be much more darker. But if you have the pneumonia inside your lungs itself or cuff, then that region will appear as a white. So these images clearly give the idea about the patient condition, like how much the deformity or how much the pathological condition it is there inside the patient. So that is about X-ray. But if you wanted to go deeper into a bony structure, then CT images are referred most of the time. And if you wanted to go deep into the soft tissue, then MRI will be preferable. And if you want real imaging, real time imaging, then the ultrasound image is referred. Like if we wanted to check the fetal development, then most of the time the ultrasound is referred. And for the metabolic activity, the PET scan is preferable. So we have talked uh, about the modalities, by which means we can get the images. But whatever the images that we are getting, how that particular information is transformed to a particular image. Here you can see the representation of a CT where we can see this particular area zoomed here. We are able to see that these are the pixels which is having the variations in the intensity. This is much more brighter. This is much more darker. This represents the bone region. So depending on the absorption of the photon, whenever the scan is happening, scanner is also emitting the photons upon the body, and body is reacting as per the absorption rate, the attenuation factor that we are able to get, and that attenuation factor is automatically giving us these values. We will be going to cover deep how this image data, which is in Hounsfield unit, that we are able to see it here, but how the machine is taking those images, and that image energy that absorbed by the body, it is converted into the Hounsfield unit. So if we go to the next slide, so these are the couple of Hounsfield unit values that we are able to see. But before going ahead to that, I just wanted to show you uh, the Hounsfield unit value. If we talk about this particular city image of me, you can see that this particular pixels having the variation in the density, and on the right hand bottom corner you will see this brighter pixel value is having nearly about 2095 hu. But if you go inside this bone, which is the cancellous bone, it will have the lesser value compared to the cortical bone. So how this particular value is coming as near about 2000, we will going to see it here. So these are the couple of values, we will come back to this, but just wanted to show how the energy absorbed by the body is being converted into the Hounsfield unit. For suppose we have the attenuation coefficient for water is nearly about 0.190, and the attenuation means the absorption rate of that particular photon and the scattering, the value is around 0.570. If we put these values here, so here is the calculation of, so 0.570 is the value of attenuation coefficient for the cortical bone that we are subtracting from the water here. If you put this value, it is coming around 0.380. So on here we are getting 0.380, and if we divide it by the mu water attenuation coefficient of the water value, then we will be getting value as 2, and if you multiply this 2 by 1000, then we will be able to get the Hounsfield unit value as we can see it here. So whatever the energy absorbed by, or the attenuation factor is there for the cortical bone in the Hounsfield unit, it is dependent on the energy that is being absorbed and the scattering done by the this particular bone. So this is how we are getting this particular 2000 value here if we calculate. And if you go deeper into that particular bone, then we will have the less value, because the when the photon are penetrating this bone, the value will be much more less. So here we will get the lesser value in the Hounsfield unit. So that is why here we have this value coming around 164. So this is how the logic behind this Hounsfield unit calculation. And here you can see the standard values. If we talk about the skin tissue, then it is ranging between minus 766 to minus 202. Likewise, we have bone value, which is ranging from 226 to 3071. So if I apply here, and if I have the range between this, then you can see the bone is selected only within this range. As my last value is 2291, I will not be able to select this maximum value. Only I'm able to 2291. So, but the minimum value I'm setting it 226. So here you can see within that range itself, these pixels, which is having the Hounsfield unit value 226 to 2291, only the bone is selected as we are able to see it here. So for the other part, like if you wanted to capture muscle, then this value we need to select in the Hounsfield unit. So this is about like Hounsfield unit value, and by using this Hounsfield unit value, how we can create the 3D model so that we can get it. So yeah, if I select that range, we will be able to get these bones. This is an example how the Hounsfield unit matters when we wanted to capture a particular region like bone or soft tissue or fat tissue. So we have seen about why medical images are matters. Second, about what is medical image. Third, how these images are stored. And fourth, that these images are stored in the DICOM format. So DICOM format is nothing but a digital imaging and communication in medicine, where whatever these images that we are able to see, 2D images, along with that information is also saved. So if I will give you example here, if I import the DICOM, along with this 2D image data, I'm also having the image information here, like the patient name here. It is anonymized as we don't wanted to disclose the patient name. But whenever we are talking about the DICOM, it will have always information associated with it. So, so what we can have in the DICOM image file, like the image data, like this 2D image data, and patient information, study, and image geometry. But if you are able to see it here, we are able to see this particular number. These numbers called as a DICOM tag, and each DICOM tag represents some attributes or information. So here, if you look at this particular information, 00100010, it will always represent the patient name. So if we wanted to cross verify here, we can cross check here as well. Let's see if we go with 00100010, it is showing the same. So this is the generic tag, and it will be same for all the scanners like Philips, Toshiba, or other scanner. It will remain same. So these are couple of standard DICOM tags. If I wanted to check, for example, slice thickness of this image, then we can check about this particular DICOM tag and we will be able to get the information. If you check 00180050, then always it will represent slice thickness. So for this particular image, slice thickness is 1 mm. That information we can get. Likewise, if we wanted to check the modality of the image that we have, you can always check for this DICOM tag in the scan data. Here we can check 00080060. So always it will show the modality. We can check it here as well. 0008 0060. So here you can see it represents same. It is the CT image, and we can check by means of DICOM tag. So that is what the DICOM file containing image information, image data plus information related to that particular patient. So as I discussed, like the other machine will also have the same DICOM tag information. So this they can speak the same language. And why this DICOM images are preferred? Like we can have these particular data with radiological data. Also, it preserves the geometrical spacing, pixel intensity in proper manner. If we talk about the other image, which is non-medical, it will not have this information. It will have the pixel, but it will not have the control over the geometrical spacing or pixel intensity. So that is why these DICOM images are most important in the medical imaging. So we have talked about how the image has been captured, how it is stored, and in which format it is stored. And there are a couple of factors associated that we have seen it here, like the slice thickness, rows, pixel. All these are the part of DICOM tag information. So these particular parameters are the key factors, like if the image quality that we have received is good or bad, or it is acceptable or not, that we can check with these parameters: spatial resolution, slice thickness, if it is consisting a noise or contrast is not good or there is any artifact. So that is how we can check the scan quality, because if the scan quality is good, then output that we are getting in the form of 3D virtual model, that will be good. So here you can see the example, like if the slice thickness of the particular scan is less than 1 mm, here you can see if we try to cover the boundary of this particular 3D surface, it will be smooth. But if it is having more than the slice is having more than 3 mm or 4 mm or 5 mm, it will have this stairs like effect. And if you wanted to cover this as a 3D model, then it will have the staircase like effect, and it will not be accurate, and it will not be useful for the surgical planning. So that is how these particular information is useful while capturing the image itself. And this is the example. If the resolution is bad, here you can see the pixelated data, where if I wanted to capture the boundary, here it is going outside. But if we talk about this high resolution, then I'm able to get the proper boundary of this bone. And whatever the model I'm creating out by using these images will be proper. This is the second example of noise and artifact, where patient is moving while doing the scan. So here you can see the motion artifact appeared here, and it is spread across the scan itself. So that is how the identification of the boundary of the tissue is very much difficult when we have these particular noise and artifact in the medical image. The second example is like metal artifact. You can see this artifact is spread all over the 2D image itself. It is hampering overall image quality, and this metal artifact representing the white pixel, which is much more brighter, and due to that, the boundary of a specific organ or the bone part, it is not visible properly. So that is how it is uh, creating clinical impact, like the whatever the segmentation or the 3D virtual model that we will be going to create, that will not be accurate. And if we do so, then also the measurement that if we are taking for the psi, that will be wrong, and final outcome will be not good. So how these things we can control, like if you wanted to get rid of these things, this image artifact, what protocol we need to follow? So general protocol is that you should have the slice thickness as less as possible. Generally, we refer less than 1 mm so that image quality is good. And also there are a couple of parameters which hamper the quality of image, which also the tube voltage and the current while capturing image itself, that can cause very much variation in the image quality. If we have much higher voltage and the current, then output image quality of that particular scan will be much more good. But what it will do, it will increase the radiation time. So it will affect overall radiation exposure to the patient. So that is not recommended, but we have to have balance between the radiation overall exposure time, so that we can think about these parameters, voltage, current, and these angles, so that we will get a good quality image. Because if we have the bad quality image, then what we will think of, like garbage in and garbage out, this is what we will be getting, the bad quality output. And also, as we talked about the slice thickness, if the slice thickness is much more, then we will not be able to get the good scan quality. So these are a couple of the things while taking the scan itself we need to think of, like we already discussed, like the slice thickness should be less than 1 mm fov. Whatever the part that we wanted to cover, that we need to capture properly region of interest. And if we are considering bone part, then while scan itself, the algorithm or the kernel that we are selecting, if we select bone, then the scan in bone part in the scan will be much more brighter. If we wanted to go with the soft tissue, then there is a algorithm, soft algorithm is also there, we can use that, so it will highlight the soft bone, soft tissue part very much clear. And while capturing the image, the Gantt retail should be 0. And in some of the scanner, in the recent scanner, we have the option called artifact reduction or metal artifact reduction. It is there, MAR. So if we turn on that, then whatever the image that you are able to see it here scattering, all the scattering will be reduced and you will have the clear picture of the scan. So these are the parameters are considered while doing the scan. So what are the real clinical use of these particular images? It is used for the diagnosis and detection. Like if we talk about the detection of tumor or congenital abnormalities, that we can get it by CT and MRI. And it also, if suppose anyone is having the fracture and he is doing the CT, then we can prepare a 3D model by using these CT images. So the surgeon will get to know about his condition before opening actual patient. So he will, what he will do, he will do the virtual planning before going to surgery, so that he will be able to get the cutting guides, and he will do the surgery in very much optimal way, so that the blood loss and overall time for the surgery will be less, and the recovery will be much more faster. And it is also these medical images also used for time intraoperative guidance. So this is the surgical navigation, which is also called as GPS for surgery or intraoperative surgery, we can say. And while doing the post-op assessment, these images are also referred to check whatever the surgery that has happened, whether the patient is having a proper outcome or not, he is okay or not. So these are the advantage of medical images. And here you can see what we have seen, like first slide was why the medical image matters. Second was the medical image, how about the medical image, what is medical image. So here you can see medical image that we are getting from the CT scan, and then this image are the input to the segmentation software, where we will be importing the CT images here and converting into the exact patient anatomy 3D virtual model. And these models, virtual model, will be helpful for the planning purpose and designing purpose. Like here you can see there is a defect in the mandible. The planning has been done, and this is a fibula flap planning, where the surgeon is deciding the how much cut that he wanted to do, and depending on that, the design has been made. And here we can see the 3D printed part that will be used during the surgery to get the proper cut these parts by using this particular cutting guide. And final outcome, you can see it as this. So all this is happened because of the image that we have in the medical image format, which is proper, good, and due to that we are able to do surgery. And these are the couple of application across particular specialties of medical images. Orthopedics, when especially there are complex cases where surgeon is not able to decide which standard uh, guide or standard implant need to be fixed to the patient, then they can get the CT scan done, and they can do the patient specific implant design for that particular patient. It is also used for CMF, OMF, neuro-oncology, cardiac surgery. So these are the images are a foundation for any surgical planning, treatment. So this is the initial point for everything that we are able to see it in virtual manner in the 3D form, and it helps to the surgeon before actually going into the surgery. So this is what we have discussed today about the medical image in detail. And if you have any questions, you can drop it into our chat so that we can take those questions here. And we will, the now floor is open for the questions. If anyone is having any doubt, then we can get started with. How can the process can be optimized so that human errors can be made reduced? So this is a good question. So whenever, like as we have seen, we need to have a certain protocol that we need to follow. Like as we were talking about the scan parameters that need to be proper, like the voltage, the current, the gantry tilt, all those things. That whenever a CT technician or the X-ray operator is going for taking the scan itself, then that time they should follow this particular protocol to get the proper scan, image scan. Second question is, what are the job opportunities in India? So there are different types of opportunity like we have seen here. So uh, you can work as a segmentation engineer, and if you are working in the patient specific instrumentation company, there is a requirement for the segmentation engineer, as we also have a couple of segmentation engineer in our company. So what they usually do, they usually check the scan, they import it into the software, they convert it into the 3D model and after converting it into the 3D model, it is being shared with the surgeon or the doctor. So they will surgeon will get to know about the condition of the patient before going to the surgery, and they will communicate the engineer and the surgeon whatever the 3D model that we have created, it is proper or not. And after that, getting the surgeon approval, it will be shipped to the design part itself if it is there, if there is a requirement. So first part is, as a segmentation engineer, we can get this opportunity. Second part is that, like design engineer. So we also have the couple of design engineer who works with closely with the doctors, as we have as the 3D model is generated, then generated model will be a patient specific model. On top of that, as we have seen earlier in this particular example here, I will share my screen again. So here in this particular example, so first part is like segmentation engineer who creates the 3D model. Second role is a design engineer, where whatever the 3D virtual model that we have created, it is being shared with the design engineer. Design engineer will discuss the condition of the patient, and as per the surgeon guidance, he will make a plan. and he will share with the surgeon. Once we will get the surgeon approval, then we will share this digital file for the printing, and printing will be done by the manufacturing team. So manufacturing is also a third opportunity where uh, people can have. So these are the three different opportunities. Apart from that, in the recent advancement in the industry, you can also work in the AI domain, where whatever the image that we have in the CT, we can convert it into the 3D. But for to have the AI automatic segmentation, we need to have this model created, and these created model will be fed to the algorithm. So there is an opportunity for software engineer here as well to create automatic segmentation model. It can be focus on the OMF or other part of body. So this is also an opportunity. And the next question. So that was about the opportunity. And also, if you are dealing with medical devices, then you should follow couple of rules and regulation. As we are working in the India, we need to follow the rules set by the CDSU. And if you are doing the business in the US, then you need to have the FDA compliance. So for that also, we need to have the regulatory team who is having the knowledge of the regulatory affairs. So that is one also opportunity for biomedical engineers. What does post-op assessment means? So if there is a fracture happen, like I can show you the example in the PPT itself. Sharing my screen again. It is not. But like, for example, if there is any fracture for a particular patient, he has admitted, and initial condition that he is having the break in the bone, and a surgeon said that he need to be operated, and implant will be fitted. So after the surgery, he will have the patient will have the implant fitted into it. But after couple of days, the doctor will also do the assessment. Whatever the implant that has been fixed, whether it is fixed properly, how much it is accurate, and patient is feeling good or not, whether he is living normal life or not. So after surgery as well, there will be a follow up after couple of months, like 2 months or 3 months. Then they will see the bone growth as well, alongside with the implant, and whether the outcome of that patient is good or not. It will be checked by taking the images after 2 to 3 months post of the operation. Then the surgeon will also get to know about the patient condition after the surgery, whether the surgery is what we have done, the outcome is good or not. Depending on that, further action he can decide, the surgeon. The next question. There are a couple of more questions here, but I will take one or two questions here for the more. Uh, with the increasing use of artificial intelligence imaging techniques, are there are any cybersecurity concerns? Yes, of course. So whenever we are handling any patient data, that we need to handle with care. Like here what we used to do, whatever the data that we are getting from the surgeon, that we are patient name is replaced with a particular uh, name itself. it is having the code like first initial of that patient, then the number of the case. So likewise we are identifying the patient name. So like we will not be disclosing the patient detail uh, to anyone. And also this whatever the data that we are having, that we are storing on AWS, which is HIPAA and cybersecurity compliant. So that is how the cybersecurity proof it is. After extracting the DICOM images into a 3D model development of the implant through any other design software. Yes. So there are a couple of software in the industry that can do only segmentation, like what we have seen my segmenter, which converts the 2D image data into 3D. But if we wanted to design the implant, then there are a couple of other softwares available in the market. We can see the SolidWorks, Freeform, and if you talk about the open source, then Blender. But if you wanted to go with proper software, then we can refer the Freeform software for design purpose. So I guess we have almost covered all the topics here. So yeah, I guess we can conclude this session for now. But this is the first episode that we are talking about related to the medical image. But in the next session, what we will be going to cover, like we were discussing about the 3D model creation, which is segmentation. So I will just share you one video here, what we will be going to cover. So now we are familiar with the image, but using those images, how we can convert the 2D image data into a 3D model. Like we have seen, we are capturing the bone model here. So what we will do, we will import the DICOM here. Then we will, depending on the region of interest, we will select the threshold value, which is in ounce per unit. And then after, we will try to cover region of interest. For this particular case, we were focusing on the spine. So here, other region we are cutting down, and you can see we are just focusing by using these segmentation tools. We will going to cover these tools in very detailed manner in the next upcoming episode, so that you will get to know and you will learn by using the CT images, how we can convert it into a 3D virtual model, and which will be a patient specific. So these things we will be going to cover in the next episode. So yeah. So thank you everyone for joining this particular session. And if anyone is having any question furthermore, then this is our website where you can go and register your queries, and you can also email us whatever the questions or concern. Many of the question was related to the job opportunity. You can also ask other questions here, and we will be happy to answer those questions as well. Yeah. Thank you everyone for your precious time, and have a nice day. Bye.